Hey, what's going on? Stephen from Crux. My foot model here is Alex Nimmer, and we're going to talk a little bit today about plantar fasciitis, most common cause for foot pain. So, people who deal with pain first thing in the morning in their feet, it's plantar fasciitis, more likely than not. Now, we'll talk in a little while about some other things that can mimic plantar fasciitis, but the video today is primarily about that. So your plantar fascia is a fibrous band. It runs from your heel all the way out through the rest of your foot. It is attached to the heel bone, which is called your calcaneus. Let's say it's about right there. And so most people deal with pain right in through there, closer to the heel of the foot. However, this can cause issues all the way out and through. So the plantar fascia attaches all the way down here on the ball of the foot. And so this fan-like band runs through the entire foot there, like that. So it is not a muscle, but rather kind of a non-contractile fibrous band, and kind of like a ligament or a tendon. However, there are muscles underneath that assist with decreasing strain to the plantar fascia. It acts as a spring. So we have an arch to our foot. Go ahead and bend that foot just a little bit so they can see, and bring that knee up. Good. So you can see Alex's arch to his foot here. The plantar fascia sits attaching from here to here and helps to keep that arch in that position. As you go through a walking pattern, and as your foot goes from heel to toe, and then you toe off as you walk, that plantar fascia will spring forward and allow you to propel forward. It helps the calf to do that motion. So the plantar fascia will have an issue. We'll get more irritated in that plantar fascia if we are not able to maintain that nice arch through the foot. If the foot muscles underneath the plantar fascia are not supportive enough, then we will drop through that arch a little bit, and that will constantly strain that plantar fascia, right? Another common irritant to the plantar fascia is excessive tension through the calf. So you can see here that as the plantar fascia attaches on this side of the heel bone, on the other side of the heel bone, the Achilles tendon, which comes from the calf muscle, attaches. So if you're constantly tight through the Achilles tendon or through the calf muscles, that will pull on the other side, which will constantly tension that plantar fascia. So one of the most common issues with plantar fasciitis is too much excessive tension through the calf, right? So what we do oftentimes is kind of look, when someone comes into the clinic, we look at how are you moving and what are the your specific causes, and the two main things are the instability through that foot and inability to kind of control the arch of the foot, and the other issues is excessive tension through that calf. Okay, so there's a short inflammatory phase to plantar fasciitis. We go through this inflammation, the actual itis of the condition, but then it goes through kind of a degenerative, irritated phase. This can last a long period of time, and the key to fixing it is a couple different things. One is stop aggravating it, right? We'll talk about how to do that here in a second. The next thing is take away the cause for it. So the cause being either that excessive tension or instability through the foot. There can be a couple other things, but those are the most common. And then lastly, once you take away the cause and you give it a little bit of love and stop aggravating it, then we need to start slowly, progressively create some durability and put some strain into that so we can build up some durability through that tissue. So let's talk about that first little bit. So how do we stop aggravating this? Well, we mentioned that first thing in the morning is the worst for the plantar fasciitis. What ends up happening is overnight we sit, our sheets of our bed kind of hold the foot there, shorten up that calf as the foot is pointed, and so this goes into, it heals up overnight and does a little bit of healing, but then first thing in the morning we stand and we stand up and that arch goes like that and ends up irritating that plantar fascia. Every single morning you have this irritated phase that then you work on healing for the rest of the day. So how do we prevent that? Well, one thing is we can decrease the excessive tension through that calf by decreasing the amount that the foot is in that position overnight. So first step would be simply untuck the sheets in the bottom of your bed. You can place a pillow just past your feet in the bed, which will lift the sheets up just a little bit. It'll also allow your foot to have something to push against or rest against, so it can sit more in this 90-degree position. And then lastly, if that's not enough, overnight there are things that you can wear. Traditionally, there's a Strasbourg sock. Some people don't like that one because it pulls back on the toe. But there are other boot-like things that you can wear. I can help you find one if you want. That holds the foot more into this 90-degree position so as not to shorten up that calf all night long. The other thing is, before you start walking away from the bed, you get out of bed, or you wake up, you roll over in the bed, you sit up, and you start to work through that tissue before placing weight on it. So you're going to use a lacrosse ball, a golf ball. My favorite is a textured ball called Foot Rubs that you can find on Amazon, RUBZ. And you can just work through and create some more pliability through the plantar fascia, and just kind of working, just literally placing a little bit of weight and getting some pliability before you fully stand up and place your full body weight on there. It will make the initial irritation significantly less. The next thing that you can do also is throughout the day, stretch that calf just a little bit because constant tension through there will make a difference. There are exercises you can do to strengthen the bottom of the feet and the muscles into deep in the calf. So this will help build up that arch and create some more stability through the foot. We'll link a couple of those on our website as well. And then in the office, what we'll do is we will use, I'm going to need that. We will use some manual therapies. So I'll do some active release technique to kind of open up through the plantar fascia and the muscles underneath the plantar fascia. We'll make sure that the big toe joint is moving sufficiently, and we'll do some manual therapy to the back of the calf as well, just to make sure that the tissues are nice and pliable. So typically after I work on that, for someone who has plantar fasciitis, they stand up and say, holy moly, I feel so much better. Now, that improvement will be short-lived if we don't then create the stability that we need to through the muscles deep underneath the foot. So again, manual therapy, or we can use tools. So we can use some tools to kind of work through the bottom of the foot, just doing little bits of movement like this to work on creating a little bit more pliability through that tissue. But again, we need to then create some strength so we fix the root cause of that, right? The other thing that once we get all of the muscles of the feet strengthened up, once we get everything a little bit more stable through the foot, then we need to create some durability. So this goes into, and there's lots of different ways to do this, but if you're a walker, as soon as your foot's feeling a little better, it doesn't mean that you need to go out on your, an hour or two of walking to really test it, right? We need to slowly and progressively load it. So the first day you go out and you do a 10-minute walk. Next time you go out and you do a 15-minute walk. Each time adding just a little bit, or we go a little bit faster one time, right? And if we ever see that your symptoms go too far after one of those walks, after that next step, we just scale back just a little bit. It's this cat and mouse game where we add a little bit, take a little bit back, right? If you're a runner, that means initially starting out with a run walk. Instead of going out for your 8-mile run the first time, as soon as it feels good, we're going to slowly progressively add load so that your tissue can create and build up some durability. So I want to talk about one more thing before I let you go. And that is two different conditions that can mimic this. There are a couple others, but the two main ones are, one is an issue in the low back. So if there's nerve impingement in the low back, this can irritate the nerve there. The brain will think that it's a problem down in the foot because that nerve goes all the way down to the foot. However, the issue might be happening in your low back. We can help you in the office to figure that out, whether that's you. The other thing is that the nerve can get impinged a little bit lower. So go ahead, bend that knee again for me, Alex. And bring it up as much as you can. So there's a nerve that comes down through the back of the calf. It goes behind that ankle bone there, wraps around and down into the bottom of the foot, right? This nerve, notice it goes to the same area that the plantar fascia is in. So if that nerve gets entrapped somewhere here or up in through here, right, it gets compressed or entrapped or tensioned through there, then it can mimic the plantar fasciitis, but in actuality it's not a plantar fascia issue, it is a nerve irritation, right? So oftentimes people will have similar feeling pain, but they'll say, no, it's not necessarily worst first thing in the morning. It hurts during this, that, or the other activity, right? This is usually my first clue to maybe it's not plantar fasciitis, maybe it has more to do with nerve compression, right? The other thing is that people will say, it hurts in my foot anytime I bend over to pick something up or anytime I go to put on my shoe, right? Well, this is not irritating for the foot. That's not an exact stress to the foot, but rather it is a stressor for that low back, and that therefore the issue might be in your low back. So anyway, a couple different things can mimic it. We can help you figure it out if you don't know. So thank you so much for watching. Let us know if you have any questions. Shoot us an email. Contact us through the website. That's Plantar Fasciitis. Thank you very much for watching.